If you are over 70 and your doctor recently told you that your blood pressure reached 120 over 80, this information is especially important for you. A study published in the Journal of the American Medical Association followed 15,000 older adults for 5 years. The findings were surprising. Those with so-called perfect blood pressure had a 28% higher risk of serious falls, and their overall survival was lower than those with moderately higher blood pressure. Over the next minutes, I will explain the blood pressure range associated with the longest life, why standard targets can be risky after age 75, and a simple home test that can reduce your risk of falls. Before we continue, leave a comment with just your age. This is important because the information applies differently if you are 65, 75, or 85. If you have ever felt dizzy when standing up, add the word dizzy to your comment. You'll see why this matters in a few minutes. Here's a common scenario in doctors' offices. A 78-year-old comes in for a checkup. Blood pressure reads 145 over 86. The doctor sees the standard target, below 130, and adds a medication. 6 months later, the blood pressure is 124 over 78. The doctor is pleased. On paper, it looks like a success. But what happens when this person gets up at night to use the bathroom? Their pressure can drop to 88 over 56 within seconds. The brain receives less blood, balance is lost, and a fall can occur. This may lead to injury, hospital care, and long rehabilitation, and sometimes loss of independence. Recent research in JAMA Internal Medicine confirms this. Moderate blood pressure in older adults is safer than perfect numbers. For people over 75, systolic blood pressure between 130 and 145 is linked with fewer falls, fewer fractures, fewer hospitalizations, and better cognitive function. Pressures below 120 increase the risk of dizziness, fainting, and kidney issues. Why does this happen? 3 key changes occur with aging. Arterial stiffness. Older arteries are less elastic, so slightly higher pressure is needed to maintain proper blood flow to the brain and kidneys. Slower baroreceptors. These pressure sensors in blood vessels react more slowly, which can lead to dangerous drops in blood pressure when standing, known as orthostatic hypotension. Medication metabolism changes. Kidneys and liver process drugs more slowly, so standard doses for middle-aged adults can lower blood pressure too much in older adults. The study followed 15,342 people over 75 for 5 years. Groups with blood pressure below 120 had 28% more serious falls and 14% higher overall mortality than those with pressures between 130 and 140. High pressures above 150 also carry risks. The key finding: very low pressure in older adults can be just as dangerous as very high pressure. How can you check your own risk at home? There is a simple test: measuring blood pressure lying down and immediately after standing. Lie down for 5 minutes, take your blood pressure, and record it. Stand up and take your blood pressure immediately. If your systolic drops more than 20 points, or your diastolic more than 10 points, this is a warning sign to discuss with your doctor. For example, lying down your pressure might be 125 over 78. When standing, it drops to 98 over 64. Your brain isn't getting enough blood when upright, even if sitting pressure looks perfect. Recommended blood pressure ranges by age: 65 to 74, generally healthy. Systolic 130, 140, 75 and 184, relatively healthy. Systolic 135 to 145, over 85, or frail individuals. Systolic 140, 150. A diastolic pressure for older adults should generally stay above 65, ideally 70-85. Blood pressure varies throughout the day. One reading doesn't reflect your average. Home monitoring gives a more accurate picture than occasional office measurements. Each person is unique. 2 81-year-olds with the same blood pressure, 158 over 88, may require completely different approaches depending on health and activity. The principle is treat the person, not the number. Here are practical steps you can start tonight. Get a home blood pressure monitor. Measure twice daily and keep a log. Perform the orthostatic blood pressure test I described. Monitor for symptoms: dizziness, fatigue, difficulty concentrating. Schedule an appointment with your doctor to discuss individualized blood pressure goals. Bring your home readings and orthostatic measurements. If medications cause side effects, speak up. Adjustments can improve quality of life while protecting cardiovascular health. Now you know that universal blood pressure targets are not suitable for everyone. For older adults, especially over 75, systolic pressure of 130/145 is associated with the best outcomes. Below 120 increases risk of falls, orthostatic hypotension, and kidney issues. Above 150 increases cardiovascular risk. The sweet spot is in the middle. You've learned how to test for orthostatic drops at home, why the older body needs different targets, how to discuss your goals with your doctor and participate actively in your care. This knowledge empowers you and can help your loved ones make safer choices. Share this video with friends or family over 65 and subscribe for research-based, practical advice. In the next video, I will cover 3 supplements shown to support healthy blood pressure naturally, and 2 popular supplements that are not effective. Remember, this video is educational. Never adjust or stop medications without consulting your healthcare provider.